Stop scrolling, pregnant mom. What if I told you that simple yellow color in your baby's eyes or even skin could sometimes be harmless, but in some cases, it really needs urgent attention. Every pregnant woman needs to understand newborn jaundice before giving birth. Yes, it could help you recognize when your baby needs medical care. Stay with me until the end. Yes, what is jaundice? Jaundice is when a baby's skin and the white of the eyes turn yellow because there is too much of a substance called bilirubin in the blood. A newborn baby's liver is still developing and may not remove bilirubin quickly enough. Therefore, it causes it to build up. The good news is that many newborn babies develop mild jaundice and it's often improved with proper monitoring and also care. However, some baby need proper treatment. Here are signs of jaundice that every parent should know. One is yellow skin, usually starting on the face. Yes. Another one is yellow eyes. That is the white part of these eyes will turn yellow. 3. Difficulty waking for feed or unusual sleepiness. 4. Poor feeding or difficulty in breastfeeding. 5. Weak or high pitch crying. 6. In severe cases, the yellow color spreads to the chest, to the tummy, to the arms, and also to the legs. Which babies are more likely to develop these jaundice? Babies born before 37 weeks, which is premature baby, they are likely to develop these jaundice. Another one is baby who have difficulty feeding in the first few days. They are likely to develop these jaundice. Another one is baby with a family history of significant newborn jaundice. Again, babies with certain blood group incompatibilities such as ABO or rhesus incompatibility. Yes, these are people or babies that are likely to have this jaundice. Can this jaundice affect your babies? Most newborn jaundice is mild and goes away with monitoring or even treatment. However, a very high bilirubin level that are not treated properly can affect your baby's brain. Yes, which is why early assessment is so important. That is why you should never ignore yellow skin or even yellow eyes in a newborn baby. Again, avoid wearing your newborn baby either red clothes or yellow clothes. This will prevent you from knowing when the baby has started developing jaundice. Then, how is it treated? Treatment depends on the baby's age, level, bilirubin level, and overall health. Your healthcare provider teams may recommend frequent feeding to help your baby stay hydrated. Do you get? And also blood tests to measure bilirubin level if needed. Then another one is physiotherapy, which is a special blue light treatment which helps the baby's body to break down bilirubin. Do you get? A small amount of babies with very severe jaundice may need more intensive treatment. Then when should you seek for medical care? Contact your healthcare provider immediately if your baby's skin or eyes are becoming more yellow. Again, your baby is finding it difficult to wake for feed. Again, your baby is feeding poorly. Then jaundice appear within first 24 hours after birth, or you are worried about your baby's color or even behavior. One of the most important lesson I teach mothers is that never assume yellow skin is normal. Do you get? Without having your baby assessed. So every recognitions and treatment can prevent serious complications. Do you get? Trust your instinct, mama. If something doesn't look right, seek for medical advice. Do you get? Many parents think that a newborn jaundice is just normal. Why mild jaundice is common? Some babies need urgent medical attentions. Do you get? Knowing the warning signs could make a life-changing difference. Have you ever seen a baby with jaundice, or did your baby have it after birth? Share your experience below. You might reassure or even educate another parent today. Save this post, share it with every expecting mom, and also follow for trusted midwife led pregnancy and also newborn education. See you in my next video. Make sure you share this. Very important. Bye.